moments in time where one may feel they're right back at the beginning, but in fact, you're not back at the beginning. So these are real opportunities, and that's what we coach people about, is these are opportunities to learn how to get back on track when you've kind of slipped or feel that you've faltered in some ways. They might inadvertently wonder why they're thinking about food or why they're feeling more urges, for instance, to binge. This would be a chance to reflect and think, maybe I should call my therapist, maybe I should speak to somebody about it. And in that conversation, usually people figure out or reveal that inadvertently they've started restricting again, like all of a sudden they've just stopped adding the fats, or all of a sudden they just started skipping snacks. So these are really common. Real challenge is to both recognize them and then get back on track. And the getting back on track is usually getting back onto a meal plan or whatever it was that helped people get well in the first place. There is this sort of alarming statistic that it takes people 4 to 6 years to go into treatment for an eating disorder. And the process of recovery is probably 4 to 6 years. So it's not an overnight thing. It happens over a long period of time. Resilience and the flexibility to come back is really what will aid somebody in recovery. At WaterStone is quite unique in that once our intensive programs are completed, a client always has the opportunity to what we call step up, which means to return to a more intensive program if they need it. Many programs, when they end, it is over and there's very little follow-up. But at WaterStone, the doors open, and we see this again as a natural process of recovery, that people will have difficult times, and the sooner they're able to reach back and ask for help, the better. We also continue to see people in individual therapy for up to a year if they like. People outside of the WaterStone community, sometimes it's best that they find a really good therapist locally who they can reach out to when they're in trouble, because therapy can go on for years and years, and at some point people want to try life without it. But they should know that they always should feel able and to go back to therapy when they need it.